themes, that they had to reach areas. Were to ensure that they had to reach areas, actually, people would be more attracted to work in the hard to reach areas. And there are good working conditions for the people who work in most of these areas. And then we also created what we call centers of excellence where we can work. We have about over 20 centers of excellence that are able to offer basic emergency, obstetric and newborn care services, BMONC services, according to guidelines. And then we also looked at financial and non-financial incentives. So briefly, I'll just go through some of these incentives that we did. This is the model, financial and non-financial. And this is, the other problem we had was sometimes even inequitable distribution of staff. Many staff will actually want to work around Lodwar, but not in areas like Kibish, the far right near Ethiopia, or in Kapedo, or even in Loima areas of Urum. Areas that immunization, full immunized child sometimes will go to around 11%. But we have to work around this to make sure that staff were also equitably distributed and they will work in those areas. So what did we do? Simple things that any county probably will do. Some of the things that we'll do, for example, to make sure that they had to reach areas people will go to, include providing adequate housing. Before we construct a health center or a dispensary, housing is part of the things that we look at to make sure it's available for the staff. So adequate housing with electricity and water, working with the other sectors within the Turkana County government are some of the things that we put in place, and it's ongoing and the implementation is also in progress. We also made sure that sub-county and facility support people were actually provided with utility vehicles that will take them to work, sometimes far from work, or take them from Lodwar to their place of work. And sometimes they plan to make sure that they are available in their place of work. Why this is important is previously, a person will stay in Lodwar for 10 days and will not go back to their place of work. So what do? So we had to invest in making sure that there are means of transport to their places of work. Amenities in some hard to reach areas, we started rooms where we provide Suzuko or DSTV so that they can also get in touch with what is happening in Nairobi. They can feel part of Kenya, so they can watch the news. They feel like they're part of, and they don't feel like they're isolated in the remote areas of Turkana. So those things were available to the people there. But also, we provided training opportunities for the people, especially in hard-to-reach areas. We give preferential treatment to the people who work in these hard-to-reach areas. And if they want to go for postgraduate or any other upgrading, they're the ones who give more opportunity. Then we do regular support supervision, including feedback and mentorships. Now, what are the other things that we have done to make sure that the environment is more attractive? We've done, because sometimes you find one member of staff is the one that is handling the whole of our whole facility. So there's no time for leave. They cannot go back home. And sometimes they just burn out and they decide to go away. So what do? So some of the things that we have done is to make sure that there is a plan to make sure we have one or two. So although we have facilities with one staff, but there are fewer than was actually in 2013. So we currently have some facilities with 2 staff or 3 staff. And then we're also working with other ministries in the county government to make sure water, basic sanitation facilities, and lighting facilities are also available with support from partners also, and regular and available supplies of commodities. So I've talked about in-service training and what we do, and how many staff, almost all of our staff undergo some training in a year. So there's also the ongoing strengthening of some facilities that were not able to offer the 7 signal functions in CIMONC and deliveries. So these ones, we have facilities that we actually uplifting to what we call the centers of excellence, able to offer the 7 signal functions. So these are the CIMONC centers. This also makes the work condition attractive. So there are many opportunities that we work on, including providing doctors with quotas, with electricity. We also give our doctors, especially the specialists, return tickets to Nairobi. We make sure that they can come to Nairobi and see their families, usually every quarter, and we pay for return tickets. These are some of the small incentives we do, but they actually will make the staff appreciate their existence in Turkana. And then we also provide motorbikes and motor vehicles for people in far-flung areas. Critical is that all our county government staff, health workers, all have an insurance with Jubilee. So everybody is insured. So their families, they can sleep and they can work in Turkana